Presenting, our SWOG S2107 as a trial in progress abstract at this conference. This is based on a trial that's actively enrolling at sites across the United States right now, evaluating Encorafenib and Cetuximab alone or in combination with Nivolumab for patients with microsatellite stable BRAFV600E metastatic colorectal cancer. This population of patients is one in colon cancer who, have less favorable outcomes, and one that is in dire need of new and more effective therapeutic options. We had observed in a lead-in study at MD Anderson that was reported at this meeting 2 years ago, an overall response rate of 50% with Encorafenib, Cetuximab, and Nivolumab, and we've seen over 10% of our patients on that study who remain on treatment over 2 years. In addition, on that study, in our lead-in study at MD Anderson, over 25% of the patients stayed on the treatment with Encorafenib, Cetuximab, and Nivolumab for over 1 year. So we saw some very promising signal that the addition of immunotherapy to standard treatment with Encorafenib and Cetuximab may offer benefit in this population of patients who have a poorer prognosis, and this is why we're evaluating this study more formally. So the SWOG S2107 study is, again, looking at patients with previously treated microsatellite stable BRAFV600E metastatic colorectal cancer. Patients are randomized to either Encorafenib, Cetuximab alone or in combination with immunotherapy. And it's a 2-to-1 randomization, so participants would have a 2/3 chance of receiving immunotherapy in addition to standard treatment. The trial is enrolling at sites across the U.S. and would be happy to talk to any investigator or any oncologist who has a potential patient to see if this would be the right trial for that patient or to help facilitate a closer site for a patient to hopefully accrue onto the study.